I am going to go ahead and get us started with some introductions. Waveen, what do you need from me to get up to speed on tech support?
Well, I was to make you co-host, and it looks like I don't have that ability. So I just need for you to roll with this beautiful session, and I will figure it out from the sideline.
That sounds great. Hello, everybody. Welcome. Welcome to day one of Culture of Data. We're so excited to have you here. I'm going to start just by introducing myself. We really appreciate you all joining us. My name is Kim Boyd. My pronouns are she, her, hers. If you feel comfortable doing so, you can rename yourself in your chat box by hovering over your small square, clicking on the three dots. It would be great to have your name, and if you feel comfortable doing so, adding your pronouns into your identification on your little box. So I'm going to be moderating this session today, and we also have Waveen in the background as we are helping with some tech support, make sure everything runs smoothly. You all should be muted now, but if you have any questions during the Q&A session, please feel free to unmute. And unlike the main session, if you were just there, you should be able to use the chat because we are actually in a regular Zoom format, not in a webinar format. So please feel free to make comments and whatever thoughts you have or questions in the chat along the lines of any of the presentations as well. So let me get started.
Can I hop in real quick to note that in case anything crashes on your end, I have downloaded both presentations, and so I'll share my screen if anything were to happen on your end.
That sounds great. Wonderful. Thank you very much. Well, we're going to have two presentations today just to help you understand kind of the lay of the land between now and 2:15. Each presentation will be about 20 minutes long. We'll have a 10-minute question and answer session after that related to that specific presentation. And then we're going to have about a 5 to 10 minute break in between the two sessions where you can get up and walk around. And welcome to this particular session, which is New Partnerships and Centering Community Voice in Public Health Practice. I'm excited for this particular presentation. I'm happy to be moderating, and I am proud to introduce Waveen, if you wouldn't mind pulling down the Culture of Data landing page, and Anoushka is going to share the presentation. Our first presentation is Maternal Health Equity, Centering Member Voices, presented by Anoushka Millear and Katie TenHulzen. So I'm going to pass it over, and I'm looking forward to hearing from you both. Thank you very much.
Thanks so much, Kim. Thank you all for joining us this afternoon. We're so excited to share a bit about our experience of centering member voices in our maternal health equity reporting. We're here today to talk about the methods we used to produce our latest maternal health equity report at the Colorado Department of Healthcare Policy and Financing, which we fondly refer to as HCPF. Some of you all may know us as HCPF as well. We're Colorado's state Medicaid agency. I'm Katie TenHulzen, clinical operations research analyst, and I analyzed the maternal health data and wrote up the quantitative sections of our report.
And I'm Anoushka Millear. I'm the reproductive health equity team lead at the department and the co-lead of our maternity advisory committee, which played a large role in this report, and we'll share a little bit more information about later.
First, a little bit about Medicaid. In Colorado, the Department of Healthcare Policy and Financing is the office that oversees Colorado's Medicaid programs, Health First Colorado and Child Health Plan Plus. During the COVID-19 public health emergency, our membership grew to cover 1.73 million Coloradans, although that number is expected to decline as eligibility redetermination starts up again in the coming year. HCPF works with our contracted regional accountable entities, we call them the RAEs, to coordinate physical and behavioral health services across the state. Here's a map of how those regions cover Coloradans on your screen. Medicaid covers about 42% of all Colorado births, so we're a really large payer in this space. The map shows the proportion of Medicaid covers births in each country, sorry, in each county in 2020, which aligns with our claims data that we analyzed for this report. So in 2021, a little bit of history, the department released our first maternity report, which was purely a quantitative analysis of all pregnancies and births covered by Medicaid in 2019. We're about to release this latest maternal health equity report. The cover is on the slide here, based on our claims data from 2020. But for this report, we wanted to include more than just a quantitative analysis of claims and explicitly incorporate the voices of our members. In the following slides, we'll explain how we work toward this goal. Here's a quick primer on where our quantitative data come from. We work closely with the Department of Public Health and Environment in this process, and we send them our Medicaid birth claims along with a few identifiers, and they match those identifiers with records from their birth certificate database. They then send us these matched records back, which allows us to connect birthing parent health conditions with birth outcomes. One example that we present in the report that comes from this is that birthing parents with chronic diabetes have a higher rate of preterm birth than birthing parents without chronic diabetes. The process isn't perfect. Typos and other issues cause a lower matching rate than 100%, but we're happy that our process returns nearly 85% matched records.
So as Katie said, our last report was purely quantitative data. And for this upcoming report, we wanted to include qualitative data as well. And so I'll tell you a little bit about where those data came from. So we have something at the department called the Maternity Advisory Committee. This committee is one of the department's committees that helps us inform policy around the department. The Maternity Advisory Committee started about 1.5 years ago. It's a 15-person committee made up mostly of BIPOC members who have been pregnant on Medicaid in the last 5-ish or so years. They're a great resource to the department, and we wanted to include them in this report since they're able to tell us about their experience of accessing pregnancy care on Medicaid. But we only wanted to include them to the extent that they wanted to be included. So in one of our meetings, we have these monthly meetings where we talk about policy, we ask them questions, we bring in experts from both at the department and other state agencies to ask questions. In one of these meetings, we asked them how they wanted to be involved. And it took a couple of meetings, monthly meetings, going back and forth and asking. But we wanted to make sure in the process that they felt that they had the power to decide how to be involved and that they could participate or not participate as they chose with no repercussions. This is a department report. It has HCPF's name on it, but it's about their lives and what they experience. So what they decided was they wanted to be involved in 2 ways. The first was being involved in this upcoming report through a series of shorter qualitative interviews. And then they wanted to be involved in the next report, so the one after this, which we have only just started thinking about, as a series of longer qualitative interviews. So that report will be primarily a qualitative report with just a few quantitative additions. And so it was their decision to participate in this way. And so we moved forward with that. So now we'll tell you a little bit more about how we actually collected data in the next slide. So the report has these 2 types of data, qualitative and quantitative. For the qualitative data, the first thing we did is Katie came to one of our meetings and did a presentation on the quantitative data, on our claims data, which is just a series of numbers. We then went through a process with the MAC of having them develop interview questions. So we said, what do you want to be asked about? What do you want stakeholders and policymakers and legislators and community members to read about? They came up with a series of interview questions. The department then administered those interviews through a semi-structured interview process. We went through a thematic analysis with multiple reviewers at the department from my team and from Katie's team. Then once we'd identified which quotes we wanted to use, which Katie will talk about a little bit, we pulled those quotes and did one-on-one meetings with each MAC member that had participated, asking not only for their consent to use their quote, but showing them where the quote was on the page in the report so they could see the context within which their information and their story was being presented. Once we had consent for all of those, we moved forward with the report process. And finally, members have been included in all of the events around releasing the report, including, for example, they reviewed these slides that we're sharing today and okayed their presentation. So now Katie will talk a little bit more about the quantitative data and how we integrated the two.
Thanks, Anoushka. As I mentioned earlier, we received the matched Medicaid claim and birth certificate data from Department of Public Health and Environment. Once that data is in our hands, our data team uploads it into a Tableau dashboard, and I use that dashboard for further analysis. Since this was our second year analyzing some of the data points, we were able to compare 2020 data with 2019 data, which was interesting. We then completed a separate claims analysis with full client level information of utilization of medical and behavioral health services. Writing the data into the report was a largely iterative process that required a lot of communication, many forms of collaboration between Anoushka's team and my team to weave qualitative themes from the interviews in with the quantitative data. This slide here, we are talking, excuse me, for the purpose of this presentation, we're focusing on how we made the report and not the results, but here we're going to share a few examples of our paired quantitative information and qualitative findings. This graph from the report shows rates of prenatal care within the first trimester across race and ethnicity groups. These categories were self-selected on the birthing parent's Medicaid application, except for the other people of color category. That is actually created by the department, combining folks that identify as races outside of these groups that are listed here, as well as folks who identify as multiple races.
So in a traditional report like the last one, we put out just this information would be presented. And the big thing about this upcoming report is we wanted there to be some contextual qualitative information from our members. So I'll show you in the next slide an example of one of those quotes. I'll read it aloud, so feel free to read or to listen. So Melissa from Garfield County reflects on her experience of having Medicaid and receiving prenatal care in her rural community. When I lived in the city, I was given more opportunities and I had more options for support and things that are more available than what I have had here in the rural areas. I had 2 children in each, 2 very rural and 2 in the city. The options for care are minimal here. You only have so many providers that actually accept Medicaid, and you don't get the perks that you get in the city. In the city, there are a lot more available to be offered. So in our report, we show both the graph that Katie talked about and this quote to give a little bit more information and context. So now we'll show another example of that.
A really huge concern during the perinatal period is the birthing parent's mental health. Several recent national reports have highlighted the need for early and adequate screening and treatment. And this bar graph represents the rate of claims billed for depression screens across race and ethnicity groups, and is a great example of how the data can only go so far in providing explanations of care that folks are receiving. As you can see here, it looks like the rate of screening among all groups is less than 50%. However, from conversations with providers and members and from tracking from our regional entities, the actual rate of depression screening provided is likely closer to 90%. So this is just an example of how we're aware that billing issues contribute to some of these low numbers, but we're also still seeing differences in screening rates across groups with a spread of nearly 10 percentage points.
So now I'll share 2 more quotes that I'll read aloud. The first is from Holly from Adams County. She said, "Postpartum, I feel like someone could have reached out. I guess sometimes they think we are just another number. Sometimes they could reach out and say, how are you doing? Or do you have any questions about the plans for the baby? What will the medical transport be for you and the child? Does the child have an appointment, or do you just have an appointment and need a Medicaid ride?" And Amy from Jefferson County says, "It's like as soon as my son left my body, it was all about the baby, and then I was just left in the wind. I ended up having postpartum depression very bad, and I did not feel like I could reach out to anyone, and I felt like I was forgotten. And I'll tell you, when we were doing our interviews and Amy said that aloud, I had a moment of just thinking, this is it. This is the point of this work. It's to show more than just a number. The numbers are so important, and it's this qualitative information that gives it life. So now that we've shared those examples, we're going to tell you about some of the challenges and lessons learned in doing this report and what our next steps are.
As you can imagine, it is not a seamless process to weave quantitative and qualitative data together. Yes, totally, Kim. Amy's quote is extremely powerful. We're so grateful that we've been able to include both the qualitative and the quantitative, and are looking forward to doing that moving forward. One of the biggest challenges we ran into was how we were limited to only the quantitative data points collected in our claims data. That information was already collected and already matched. So if a theme or question arose from our qualitative analysis and those interviews that we weren't able to address, or questions we weren't able to answer with our quantitative data, we're only able to see part of the picture. An example is whether or not a C-section was elective or clinically necessary. We gather information on whether a delivery is C-section or vaginal birth, but we don't have that additional context at our fingertips. In addition, limitations with how the data is reported to us or how well records match will always be a challenge, because we receive claims from hundreds of providers across the state. Elevating MAC members' stories is also a powerful way to hear from members themselves, but they can only also speak to their own personal experiences, and we cannot rely on them to represent all members.
So we've learned a lot in MAC, and I like to joke, but it is true when I say it. Every time we do something with MAC, we are learning how to do it better the next time. Often we do it wrong the first time, and we're getting better at it as we go. So an example of that, as one of our lessons learned, is coming back to this question of how does this elevate the member voice? So whenever we came to a decision point and there was a decision where perhaps there was an easier way to navigate bureaucracy and just get something done versus bringing it back to our members, we really tried to take that moment and say, how does this decision give us a chance to elevate the member voice and to go with that, even when it was more challenging from our end? Because inherently there are power dynamics between the state, between HCPF, the payer of these folks' medical care, and the member themselves. We work really hard to level the playing field as often as we can, and yet we know that it's still there. That dynamic is still there. One way that we support our MAC members in telling their stories is we have a mental health professional who's available for all of our meetings. In the best of times, pregnancy, birth, and postpartum are a really vulnerable time in people's lives. And when it's hard or when there are challenges, it's even harder to speak about for some folks. So we have a mental health professional who is available during our meetings and afterward for folks to receive extra support, because I, as the facilitator, am not trained as a mental health professional. So we want to make sure that that support is there. We also have this challenge of presenting a complete member story across a statewide overview. And so we're thinking about this moving forward. How do we tell someone's story fully and completely, rather than distilling it down to a single data point and matching it to the claims data? For example, if there's one phrase that underscores a quantitative data point, not saying that that's the entirety of the story when we know there may be more context. So for example, one of the quotes in the report, by the time the report gets to publication, it has been seen by so many people and passed through so many levels of clearance that some things have changed from when Katie and I first worked on the report. So there was a quote that was in the report and someone had changed the little caption introducing the quote. And I read it, it was almost ready to go. It was on our executive director's desk to review and approve. And I read the quote and I read the little caption and I said, this is not what she was talking about. If you just read the words of the quote on the page, sure, it matches, but I know the bigger context and this is not what our member was talking about. And so that was a moment where I had to say, sorry, I need to interrupt the process. Sorry, executive director, you need to take a beat so that we can get this fixed and more accurately represent our members' experience. And in order to do that, we need to know our members and their stories intimately in order to create those checks and balances. As best we can, we know our members that are part of the MAC, we know them well, we know their children's names, we know their stories, we know who goes grocery shopping during meetings, we know who's having issues breastfeeding. We know when folks are on leave because they've just had a baby and we send them cards. We really try to be as involved as we can in knowing their stories while still maintaining appropriate boundaries and professional relationships. Another lesson we learned during this is just how much of an administrative effort it took to do this. That is not a bad thing at all. It just means for the next report, we're building in some FTE to coordinate with members and reschedule interviews and make sure that everything goes well. And finally, we compensate our members for the MAC meetings, but we did not compensate for interviews for this time. And although no one has said anything to us about that, there was a moment where we took a step back and said, why aren't we compensating for this? So for our next report, we'll be compensating for interviews as well. So for the next steps for the report, it should be published imminently. We are hopeful that next week it will go live on the website. As Katie mentioned, we have some issues with how our data are reported to us because it's to do with payment and the structure of our payments. So there are some changes that should be coming down that make it a little bit easier for us to understand the care that folks receive. For example, being able to analyze how many prenatal visits someone has had and when those started. Our next report will have a qualitative focus, so that will be the bulk of the report. Excuse me, as I mentioned earlier. We also are starting a Spanish-speaking maternity advisory committee, which we're really excited about. More information about that coming this fall. One thing we're going to have to figure out is how do we incorporate and elevate the experiences of our Spanish-speaking members in a way that is equitable when the folks that are working on the report from the department do not speak Spanish. So that is something that I'm sure we're going to make mistakes on, and we're really looking forward to learning and just doing our best, working with our community members and our department EDI officer to make sure we're doing that as equitably as possible. And finally, we're going to continue to connect the MAC and this report with policy discussion and changes to make sure that we are giving our MAC members the opportunity to speak in their own words and their own voices whenever we can. So an example of that is our maternity report event, which is next week. One of our MAC members will be speaking at that in order to give them the chance to share from their own voice. So with that, we are welcome to any questions. Thank you so much for listening, and we hope to have a good discussion. Thank you.
Thanks.
Thank you, everybody. Thank you so much, Katie. Thank you so much, Anoushka. It was great to hear your presentation. I'm a longtime public health nurse, and I started my public health career at prenatal postpartum home visiting. So I felt really honored to see how stories are being translated to data and policy and advocacy. So thank you so much for your presentation. I would love to open it up to question and answer from anybody here in the audience. Do we have any that you would like to put in the chat, or please feel free to come off mute and or off video and help us with that question and answer. Any questions for Katie or Anoushka? I have a question. My question is, how did you select the individuals for the MAC, the Maternal Advisory Committee?
So we do go through an application process. We've had 2 rounds of applications, and in that time, we've received about 260 applicants. So we try to spread the word as far as we can across the state through our stakeholders and community members. So they submit an application and we go through an interview process and then extend offers to folks. we really do recruit for diversity of a whole bunch of different aspects of people's lives, from race and ethnicity to geography to, you know, how many kids folks have, stuff like that.
Great, thank you. I see a couple of questions and comments coming through. So from Rachel, I greatly appreciate that HCPF is incorporating more qualitative data to bring forward member voices. Thank you very much. It's so important. And Haley, will the members of the MAC change over time?
Yes, so it originally, we set out to have a 2-year period, bringing new folks on every year. So right now, we just invited new folks to join this spring. We have 7 new members, and our original cohort, some of those folks will graduate, transition off at the end of this year, and then we'll start bringing folks on in a yearly cycle.
Wonderful. And then Samantha says, thanks for sharing all the work that went into the report. It sounds like so much of this is dependent on building relationships and two-way communication with community members. Can you say a little bit more about that?
Yeah, I think that this is something that is iterative and we're learning. Our first few MAC meetings went extremely poorly. We did have members who were like, no, thank you. This is not what I signed up for. And so we have, I think in this process, just had a lot of humility and made sure that we're accountable to members. So when we do things in a way that's not appropriate, or we feel we could have done better, we go back and we say, sorry, we did that not the way we wanted to. Like, we're going to do it a little better next time. And I would say that many of these members have had to advocate for themselves over and over and over again in life, and they are not afraid to advocate for themselves when it comes to meeting with us, which is great.
That's really great to hear. Thank you very much. Lakisa said, how will you determine the compensation rate for participation?
The department has a policy on compensation, so we just go according to that policy.
Wonderful. Mike has a question. Can you please talk about the challenges you had in merging or utilizing secondary data and primary data that you used to help build out the data picture? What felt risky and how did you navigate that risk? Thanks, Mike.
And Mike, thanks for your question. I would say our report focuses primarily on our primary data that are gained from our claims information. We really tried to stick with places where we could draw conclusions or find associations, and worked really hard not to pull too much secondary in ways that would make that could mislead. One challenge that we had is, like, when we're looking at the numbers here, and especially from claims data and a whole population of Medicaid members who have given birth, it's difficult to draw, power analysis and claims of statistical significance. That's always going to be difficult in our reporting. And so the best we can do is present what we have and where there are differences. And we really tried to stick to our primary data.
Wonderful. Thank you, Katie. Any other questions for Katie or Anoushka? Okay, let's take a 10-minute break. Please feel free to get up and move around. I want to say a huge thank you to Katie and Anoushka for your amazing presentation on maternal health equity, centering the member voices. Thank you for being here and thank you for sharing your work. We'll be back at 1:40. Please get up, move around, find a way to energize for the next speaker. We'll be back in just a few minutes for another presentation. Just join us back here and we look forward to having you. We'll see you back at 1:40. Thank you. Thanks, Katie. Kate, thanks, Anoushka. Great presentation.
Thank you. Great presentation.
Hello, everybody. Welcome back. Hope you got to stand up, move around, do something to get your blood moving in between. I'm excited to get started with our second presentation for this session. Our second presentation is titled Rethinking Validity as a Funder, Defining and Measuring Meaningful Impact Through Community Partnership. This presentation will be presented by Haley Sammen and Sydney Chaves. I'm going to hand it over to you. Thank you very much.
Thanks, Kim. We're really excited to be here today. I'll go ahead and share screen. And Sydney and I were chatting in the break that we really related to a lot of what Katie and Anoushka shared. So thank you for everything that you shared. That was great to just hear about your process with all that. All right, so let's dive in.
Yeah, I'll get us started. Thanks, Haley. Caring for Denver Foundation is a taxpayer-funded nonprofit organization addressing Denver's mental health and substance misuse needs. At the core of everything we do is the belief that we can do better, both in how we support the people with mental health and substance misuse issues in our community, and in how philanthropy operates. Since opening our doors in 2019, we've sought to live into that belief through an evaluation approach that centers community knowledge and insight as valid data. Over the past 4 years, we have embedded community expertise into almost every aspect of our work, while stewarding more than $100 million to over 200 unique organizations in Denver. Creating partnerships with our community is critical to being responsible stewards of these public funds, and we know we can't truly be effective without centering community insight to better understand what works and what doesn't. We're putting this value into practice through a model that actively works to diffuse power, elevate expertise, and build capacity with each and every grantee partner.
One of our first steps to putting community insight at the center of our approach was spending our first year engaging with over 1,500 people in Denver, uncovering their thoughts on what needs to look different in our community. They helped us interpret available data from community needs assessments and other sources, as well as shared their own experiences, so we could better understand what it will take to address mental health and substance misuse. Their insights drove the creation of our shared impact plan, which is the basis of our grant making, as well as our evaluation and learning approach. With this tool, we are able to understand how each grant is contributing to the progress goals the community defined, rather than assessing community work through a foundation-defined lens. We are holding ourselves accountable for demonstrating progress in these areas, and the grantees are our partner in that. We are excited to share with you our process for working with each grant, highlighting the 3 touch points in our annual cycle: start of grant, mid-year check-in, and end of grant year. In our short time today, we'll touch briefly on both our tools and the principles of each phase, hoping it can give you a sense of what's possible. And because the grantee perspective of the process is, of course, the most important part, you'll hear from a few of our grantee partners about their experience with each phase. We had so much fun sitting down to talk with our grantees. We struggled to pare down their great feedback to fit in the presentation, but we hope we have captured some useful insights to share. So let's dive in.
At the beginning of each grant year, the program officer and evaluation partners work collaboratively with staff from each grantee organization to co-create a living project framework. This framework outlines grant strategies, intended or ideal outcomes, and the types of evidence grantees already have or plan to start collecting with this grant. This tool and process makes thinking visible for both parties by creating an intentional space to describe the priorities and intention of the work clearly. This shared clarity is essential for future honest conversations and curiosity because it sets the stage for data-driven learning and adaptations identified by the adaptations by identifying the ideal of the work so that it can be compared to the actual of the work over time. The project framework also includes space for program officers and grantees to collaboratively define how the grant aligns to the foundation's shared impact plan and what grantee-defined measures of their work will best illustrate those outcome areas. We recognize that our grantees have varying degrees of resources, capacity, and skills for evaluation, so each grant has a designated evaluation partner. Grantees can connect with that person at any point throughout the year to help them with our evaluation and learning processes and goals. This can take the form of survey design or refinement, innovative data collection methods, or simply talking through what are the meaningful measures of their work. The upfront work of co-creating this document and plan allows grantees to inform the foundation on what they hope to see change, how they will know when they see it, and how they'll report on it, all while keeping the data and reporting burden low for grantees. Like Haley said, grantees shared back with us that this process sets them up to feel like a valued partner, and they're motivated by the opportunity to measure what is most meaningful to them. So here is some of what our grantees had to say.
Be able to understand exactly what you will be expecting from us when it comes to the evaluation and the reports, and to do that together has been really comforting, because it doesn't feel punitive. It doesn't feel like it's just another hoop that we have to jump through or to perform, but that evaluation and that co-creation of those metrics in that framework is gonna keep pushing us to be better, as you all are also learning about the myriad ways in which this work can be done and how success can be measured.
Gave the project framework, I was trying to like, okay, wait, you have these goals and strategies you have, and they feed into this, and I had all the forms. I mean, I was just trying to like, okay, wait, you know, I need to step up to this plate to like really understand this and figure out like, how do we fit into this, and how can we, you know, justify that what we're doing is achieving all of these things. And it took me a minute of like resettling to be like, that's not what's being asked of us here.
When we first came on, I feel like the guidelines were so different from what other funders were expecting from us. You know, a lot of times the funders, they have a whole list of things that they want you to produce for them. They already have that up front, but your approach was very different in that you told us, you asked us what was important to us, and then gave us some free rein in order to build out our programs and our reporting mechanisms. So then it's like, okay, let's try to really figure this out and figure out what's important to us in our community and see if we can communicate that through how we're doing our reporting.
Us that have different grants and work with government grants, and they're so rigid with, you know, your goals and your SMART goals and objectives and this and that, to be able to relax and say, you know, we're going to work as partners and we're going to have these goals and we're going to create this as a team. That's really nice. I mean, that really makes a difference.
In the recovery realm, how do you measure progress in recovery? That's a question there's still, most organizations are trying to understand. They do the BART 10, which doesn't make any sense to me. And then Caring for Denver's like, okay, try this and let's try this. And then like just sitting down with me and saying, okay, what kind of questions should we ask, right? What do we want to see? What do we think will really measure progress and be an outcome that we can be proud of? And we were able to do that. We have some really good performance indicators of how we're doing as an organization and how we are making a measurable impact on the individuals we serve, their lives.
So by putting community partnerships and collaborative learning at the center of evaluation, we find it drives higher quality, greater accuracy, and more meaningful data. And because of the immense value this partnership brings to the foundation, learning partnership compensation dollars are also added to each grant as the acknowledgement of the time and expertise organizations invest in working with us. We do this to acknowledge the intellectual and emotional labor they are providing to the partnership. At midyear, grantees and their program officers have a check-in call. These calls allow program officers to check in on expectations of the grant-funded work and support grantees in sharing about their progress through oral reporting in a non-judgmental space. The structure and flow of the questions regularly prompt honest insights from both the grantees and the foundation. In doing so, the calls create opportunities to pivot the work in real time when insights are driving necessary adaptations. There is also an opportunity to refine evaluation measures to ensure the data tells the most meaningful story of the work from the grantee's perspective. When we asked grantees about this phase of the process, they shared that these calls are propellers for their work and are hugely impactful for them feeling respected by and in true relationship with the foundation.
The 6-month call is the most helpful thing that you guys do that no one else does, right? It's just a conversation. You don't have to pre-prepare the answers. We're just gonna sit down and talk through these 6 questions. And I mean, it makes us feel seen and it makes us feel heard, right? Sometimes running an organization that serves community can be a lonely job. And having someone sit down and talk with you as opposed to just sending emails back and forth is so important, right? I've learned in those calls, like things that I was doing that I didn't know that were really awesome. Like just talking to the kids, she's like, that's amazing. And for me, I can get in this mindset of I'm not doing enough, I'm not doing enough, I'm not doing enough, and I don't want to burn out, right? So just having these human to human conversations of what's it like, how's it going?
We're so in the weeds of where we want this to be and all of the work and what we hoped it would be and staying to the timeline. You know, we want this and the world. Like, we want so much more for this work that we are kind of holding a high measure for ourselves all the time and feel like we are just like still getting there. And it's been really lovely to have these reflective conversations with you and Juan, where we hang up and we're like, we're doing good work. We have a cool thing here. I just think that approach has been really a propeller for us of like, it holds up a reflective mirror for us to kind of like stop and think about it when you're so busy midstream.
It's extremely helpful to have that personal touch and understanding of what we're going through, because if we're going to solve this, it's not going to be, the solutions aren't always going to come from a well-established organization because they have a set way of doing things. We have to have a creative way to reach people.
On the end of grant year call, we collaboratively review data from each grantee defined outcome measure to ensure their experiences and context with the work are not getting lost in the quantitative metric. Through this dialogue, grantees share with us what the data tells them about their work and progress, as well as the experiences of the people they're serving. This process generates understanding, ideas, and hypotheses about the work that just wouldn't be possible by us reviewing the data on our own. By making space for meaningful numerical assessments as well as insightful qualitative reflections, both types of data are valued and actionable in the partnership. We see some of this action start to take place on the calls as we work with grantees to update and modify their living project frameworks based off of their real-time insights on the closing year's data. Excuse me. This process also pushes us to have a better understanding of what are meaningful measures of progress. We share back key insights from what we learn with the community through rapid cycle learning briefs to ensure transparency in how community insight is shaping our work to help inform broader thinking beyond our doors. We heard from grantees that this part of the process allows for capturing insight and innovations of how the work, innovations of the work, and how they have or will adapt their work to best serve the community, and that the partnership is building their capacity to be data-driven.
Ask us how everything is going. going and where we are in our progress, and we're able to express, you know, what's happening and what things that we want to improve on and what things that we need to work on a little bit and what things are going great and some insights that we might have now that we didn't have before. And then we brainstorm and we think about ways that we can capture all these new and innovative aspects that are coming out of the work that's happening. We're able to grow in the ways that we're serving our community beyond just what we thought with our original grant proposal. So I think that the learning calls are great because it's a time for us to reflect on what's really working, what things we need to capitalize, what things we need to change. And that's really what matters, you know.
Taking that time and that space to review what we said at the beginning we would do, where we are, and maybe realizing, yeah, I guess that didn't work so well. So having kind of a brainstorm session on how to change things in a way that is still good information for the foundation to be able to continue to support this type of work. But it's also good for us to be able to reach those goals. It's also a good space to evaluate how to move forward, how to change those things, so you can actually, you know, continue to do the work in a way that makes sense to the community. But so I feel like the learning calls are learning for both sides.
Kind of just like we take evaluation for granted at times, or like it's just supposed to be like easy and straightforward. And I think especially in programming positions where you're doing the programming, it's often like either an afterthought or it's just something you kind of like try to hobble together at the end, at least in my experience. So I feel like it was really valuable to have the more premeditated, like supported, thoughtful evaluation plan at the outset of the grant. And then throughout having those touch points to come back and make sure we're on track and doing all the right things and evaluating. It made it so that the final reporting wasn't kind of just like a rush at the end to get data. It felt like we were gathering it the whole time because we knew the plan and came up with the plan.
If you want to grow and really understand yourself as an organization and where you are and where you potentially could be, having a grant like this and reporting in this style is a kind of working a muscle that you just is going to atrophy. You just won't have that experience if you're afraid to do it. And you won't, if you're used to the burn and churn and you're used to just like, hey, when we have to report, we're going to write stuff or we're going to say the same. And some people cut and paste. It just dawned on me too. It's like, you can't cheat this system. You cannot cut and paste and say, what are we going to say? You literally have to be eye to eye, face to face and talk about it and be accountable. That was the word I was looking for before. It's really made us accountable. That is exactly the word. It's accountability, but it's actually really great. And if we're working that into our program and how we communicate with our grantor and our funders, we're better for it.
So our model has 3 touch points throughout each year, but we are seeing that each component is an opportunity to diffuse power, elevate expertise, and build capacity. Because of that increased capacity, we are seeing grantees gain insights from their data that are driving new interest in measuring what is meaningful to them. And because of the trust we have built, they are open to have honest conversations about adaptations to their work based on data-driven insights. And by having these conversations and relationships with over 200 organizations in Denver, we are gathering data about why things are happening, what that means for community members, and what are effective approaches to addressing issues. This process is producing data that are meaningful to the people doing the work. And because of that, both grantees and the foundation are motivated to take action from the data in real time.
Evaluation is just learning. Evaluation is learning and growing and how to deepen our commitment and deepen our impact.
Now we can make more effective decisions, stronger decisions that we have a history now.
If you're going to have any meaningful impact on your community, you're going to have to collect data. You're going to have to measure your impact. You're going to have to measure your outcomes. It's part of it's just the only way your idea or your solution is going to work and be sustainable.
I think more than anything, that's the difference too between what I'm seeing with Caring for Denver is that you're not some like typical funder that has a really high, entry point and really inaccessible, that makes you jump through all these hoops without really understanding the purpose behind it. But what I've seen and what I've felt and really come to appreciate is that y'all are thought partners in this process, that you want to see us be successful. You want to see our programs continue to grow and scale and have that kind of impact. And you're willing to roll up your sleeves and ask those hard questions with us.
I think that it was your approach to saying, we have these funds, we know that there's a need in the community. We want to support you in meeting this need. You didn't come to us with all the answers. You came to us willing to work with us to find solutions. I think what's great about it is that the power is back into the community's hands. It really gives organizations an opportunity to do what we are actually set out to do, follow our missions without so many restricting guidelines. So you're still getting what you need as Care for Denver, but then again, the organization is still doing what we need to do in order to serve our communities, and we're able to find that nice little middle ground there, which is kind of awesome.
You are a resource that can add to the work if you take advantage of it, right? So it's really look at it as a partnership and use it that way, be transparent, think deep about it, do that little bit of work to make it more meaningful, but also then on the other end, you're going to gain so much more from it, right? Just if you sign into that. So I guess I would say that really do take them at their word that they're, that you all are there to serve as supports and look at it as a partnership.
Awesome. So, for us to think differently about validity, we have to develop trusting relationships, put their voice first, and be a partner in developing the community's capacity to think critically about their work and data. We have found that all this is driving our ability to rethink what is meaningful and what matters to measure. We are so excited to start sharing about our work. And so we have a few other places where you can go dig in to see more about how the process works. And what it looks like when we roll up and share back data. And so we'll drop these links in the chat. These are kind of, we're new, we're a young organization, and these are some of our first things that we're putting out to share about our approach. And we'll also drop our emails and encourage you to connect to learn more about any of this.
Wow, thank you, Haley and Sydney. I really was inspired by your presentation. I love the you're not the typical funder, that you are thought partners. Looking forward to the Q&A. So I know that there's already a couple of questions that have come up. I'm going to ask the first one, which was from Mike. What was your biggest challenge in this collaborative participant-led process for you as the foundation?
I have a few thoughts. Sydney probably has a few too.
I'll let Haley go first. She's been here a little longer.
Yeah, so every day brings new challenges, and we are constantly learning and adapting our process. And we can put it on a slide and say, this is a process, but every day has a generative messiness to it. And we're also really transparent and humble with each partner about thank you for being patient as we've developed and learned and made progress over a few years. But one of the really, really biggest tangible hurdles is that there are 3 of us on the evaluation and learning team. And like we said, there are, over 200 organizations, close to 250 grants. And we work with every single one of them. And we have a relationship with every single one of them. And we talk to them on the phone multiple times a year. And so it's just capacity. It just, takes a ton of time. And we just have, that's what we do. We just spend a lot of time doing it, being on calls. Sydney, other thoughts?
Yeah, I think a pretty obvious challenge that we have run into is not all grantees are as interested in learning as we are. So we still get a handful that's like, can you just tell us what to report? We just want to plug and chug numbers. And they're maybe not as excited about the learning aspect of our approach. And so I would say that's one of our challenges.
Yeah, and I think that one becomes more and more overcome as folks get used to, here, we're on a call again, we're going to talk, we're excited to talk to you. So they get used to it. But I would also say that one of the real challenges is our reporting system asks people, what's your numerator and what's your denominator? And that is just a huge barrier to most people, because they just don't think about what they report in terms of having the right denominator. So there's just a lot of time spent asking people to think in a different data way that they're used to.
That's interesting. Thank you. There's another question from Mike that said, what process did you use for evaluating your own effectiveness in this collaboration? Did you use the same collaborative process internally as you have used externally?
Yeah, great question. And I would say that we're not there yet. We've just, we've been around for 3 years, making grants for 3 years. And so we're just kind of getting to the point where we have built our process. It was just December, we modified how we do the end of year learning calls. And so everything's been in modification, and no one has yet gone through the cycle really in full ways yet. We've only had the first couple of cohorts reaching their first 1 year mark. So that's, I think, what's up next for us. I think it was just 3 years of building, and obviously we get to talk to them all the time. And because we do have honest conversations, we constantly are learning what's not working for them and how to adapt in real time. But we're really excited to dig in the next, year to really starting to look back and investigate, potentially with external partners or, some thought leaders in, equitable evaluation to really say, is this having the effect we're hoping it is having, and start to uncover some of the things we're not seeing yet ourselves.
Amazing. Thank you.
Yeah, and I'll just add to that really fast. I think even though we haven't done like a formal internal evaluation of our process, Haley and I and our director, a small team of eval folks, every week we're in a room together just looking internally about what's working, what's not working, what do we need to address, and we try to make some of those adaptations real time in the moment, which is also what we ask grantees to do when we're on calls with them. So I think we're doing some of that internal reflection as we go, just not quite formally yet.
That's great. I love the way Haley said that you're embracing the generative messiness. I love that phrase. So thank you. I've got another question in the chat. What is your way forward? What's your 2023 plan or 2024 plan?
Keep on chugging.
Yeah, we are really looking at 2023 as hopefully a year of executing our model as a model, because it's been changing and building so rapidly in the prior years. And so we're really looking at this year to say, okay, this is how we're saying we're doing it, getting at least a full year in of just kind of not changing things every time, because we have 3 funding cycles. We talk, 3 times a year, we're on, 50 plus calls. And so after each time, we always want to adapt, but we're trying to say, okay, let's just go a few cycles with keeping things the same. So that's really what we're looking forward to. Yeah, Sydney, any other thoughts?
No.
That's amazing. Do other people have questions? Either come off mute and or video, or you can drop your question in the Q&A and I'm happy to repeat it. I'm curious, how was this model born? Did you role model it after something that exists, or did you create it? I love the Living Project framework. I just want to be funded by you because I want to practice it.
We have an application open right now.
It does have something that it's modeled after. So our director of evaluation, Rebecca Octera, prior to Caring for Denver starting, it was really involved in emergent learning. You can go look at, they have a new website, emergent learning community practice. They've started to put their, some resources together. They offer trainings. And so there's these principles that this group started to document around what does it look like to operationalize emergent learning? And so that is what pretty much everything we do here is based off of. So the project framework is really set up to be a before and after action review. So if you say what you're planning to do, then when you go back to reflect, you can say, how did it go? Did we do what we thought we were going to do? And so it sets up this really cool process to have a hypothesis and then, reflect back on it. And then, there's all these concepts about like returning learning to the system, making thinking visible. So all those emergent learning principles are, what we then turned into our tools and our process here. And so it's really cool. Emergent learning is widely, used across, the social sector to solve complex problems, right? Which is essentially what they based it on, was how can we as humans learn better together to solve complex issues. And then recently, organization, we put a link to this, to our article in Peak Grant Making, but Peak Grant Making also put out a really great publication in the last year about emergent learning, specifically in philanthropy. So they're starting to put out more resources too.
Amazing. Sydney, you mentioned that there is a grant application open. Who do you fund? What's your geographic limitations? Who are you typically targeting for funding?
Yeah, great question, Kim. So because we are tax funded by City and County of Denver sales tax, our funding does stay within the City and County of Denver. So we fund various nonprofits that are addressing mental health and substance misuse needs in community. They don't have to be a mental health organization. We fund a lot of like art-based organizations, and I don't know, you name it, we fund it as long as there is a mental health or substance misuse component to it and it aligns with our shared impact plan. Haley mentioned we fund 3 times a year. So the funding application that's currently open is our alternatives to jail funding area, which focuses on finding ways to keep people out of the criminal justice system who just don't need to be there. So I can drop a link to the current call for proposals, and happy to answer any questions folks have about that as well.
Yeah, and I'll just add that our 2 other funding cycles, one is focused entirely on youth and supports for youth 0 to 26, and then their caregivers. And then our third funding area is community-centered solutions. So as Sydney said, kind of anywhere that people are looking to, bring these types of care and resources to where people are and how they, receive services and connect in their own community.
That's great. Thank you so much. If you have any questions, additionally for Sydney and Haley, they have both put their email addresses into the chat, and there is a funding link there as well. So I want to bring us to a close and say thank you so much for attending this session. The session was New Partnerships and Centering Community Voices in Public Health Practice. Thank you also for engaging in the Q&A. Thank you to Katie and Anoushka for your presentation on maternal health equity, centering member voices, and again to Sydney and Haley for your presentation on rethinking validity as a funder, defining and measuring meaningful impact through community partnership. I have a few more short announcements before you head out. Slides and any additional handouts the speakers have provided will be available on the app Sked, so you can sign in there and find both the slides and any other notes that may be available. You will receive a conference evaluation form via email after the conference is over. Please, please, please fill that out, even if you only attend a portion of the conference. It's so helpful for us at CPHA to really think about how we're going to plan for next year's offering. There will be a raffle for everyone who completes the survey within 2 weeks, and you could be one of 2 $50 gift card winners. Lastly, we now have a 30-minute break from 2:15 to 2:45. During this break, we encourage you to listen to the recorded walk and talk session that is available on Sked. This walk and talk session is collective storytelling with data, how a Denver walking initiative is improving community health from the ground up. And it's about Denver's Montbello neighborhood. So I encourage you to listen to that. There are 2 presentations for you to choose from. Oh, sorry, I moved forward. The next live session is going to begin at 2:45. You've got a couple of concurrent choices for that breakout. Thank you so much for your time and attention today. Again, you can find the full schedule on the SCED conference website to determine what breakouts you would like to attend. So for now, I will bid you adieu, say thank you again to Haley, Sydney, Anoushka, and to Katie. Thank you very much and have a wonderful afternoon. Take care.